Hi, I am Dr. Arundathi. I am consultant dermatologist at Dr. Sculpt aesthetic clinics in Indiranagar and Sahakarnagar, Bengaluru. So adolescence can be a difficult time for all of us, and it can be made worse by the appearance of acne. So acne is most common in young adults. So acne is very common in patients between the age of 12 and 24 years, and hormonal changes that happen during puberty is the cause for this adolescent acne. So adolescent acne can be a little challenging for a couple of reasons. So one thing is that adolescent acne or acne in your teenage years seems to be like a near constant presence on your skin. Secondly, a lot of patients are concerned that many of the medications that we use can be too harsh for their sensitive skin of a teenager. Also, there are certain oral medications that are the mainstay of treatment of acne in adults that we can't use in adolescents. But there are certain things that we can do to keep the acne under control and prevent the long-term sequelae such as scarring and marks on the skin that can be quite troubling for a teenager. So I'm going to be giving you certain do's and don'ts that you can follow by yourself at home that can help control or keep your acne under control basically. So one thing I would like to stress upon is cleanse your face thoroughly at least twice a day. You can use certain salicylic acid based face washes only if your skin is oily, and before using any medicated face washes, it's always a good idea to seek the advice of a dermatologist. Secondly, if you are in the habit of wearing makeup, I would suggest that you cleanse the makeup thoroughly before going to bed. And thirdly, so when you're going to school, you often have to wear a mask, and masking is generally a good practice still. So when you're wearing a face mask, make sure that you wear a clean face mask every day. And fourth, seek treatment early. I would advise all parents to not neglect teenage acne and keep thinking, it's a temporary problem, it will go away. I would always advise all parents to seek treatment for their teenage kids' acne as early as possible to avoid possible sequelae. Like I was talking about, acne is not just a temporary problem. It can lead to long-term consequences such as scarring, the pits that you see on the skin, and also these marks that acne can leave behind, even if it doesn't scar your skin, can last for months, and it can really diminish the confidence of these teenage kids. So once you seek treatment from a dermatologist, be consistent with the skincare routine that your dermatologist has advised you. So some don'ts. So don't pick at your pimples. So this is a common practice. So we feel really annoyed with a pimple on our face and we try to pick at it to make it go away faster. This is always a bad practice because it will almost always leave behind a mark that can be quite dark and can last for months. Secondly, do not self-medicate. So like I was mentioning earlier, salicylic acid washes are very commonly available in the market. And these days you can order a lot of over-the-counter products that contain actives. But I would suggest that you don't self-medicate or use these products without the advice of a dermatologist, because your skin can be a little more sensitive than adult skin, and it might lead to certain side effects or complications if you're not careful. So once you seek help from a dermatologist for your skin concerns, she will help manage your acne by some prescription products like adapalene, clindamycin, benzoyl peroxide that are safe for your skin, and she will also advise you to use it in such a way that doesn't leave your skin dry, sensitive or stripped. She will also advise you on how to use these over-the-counter products safely so that you don't end up with complications.